Before I introduce that, I would just like to acknowledge that despite our virtual gathering today, that the city of Hamilton is situated upon the traditional territories of Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas, and that this land is covered by the Dish with One Spoon Wampum Belt Covenant, which was an agreement between the Haudenosaunee and Nishnabak to share and care for the resources around the Great Lakes. We further acknowledge that this land is covered by the Between the Lakes Purchase 1792 between the Crown and Mississaugas of the Credit First Nation. The title of this symposium is Beyond the Vacuum, which we think is quite meaningful based on, hopefully, the quote you were able to review in the conference guide by the late Leonard Berlin, where we believe that many stressful experiences don't spring out of a vacuum, but typically can be traced back to surrounding social structures and people's locations within them. And this really does present kind of the idea that we think of when we think of what we want ARMS to do and represent in the Faculty of Social Sciences here at McMaster. I'm going to talk a little bit more about the ARMS initiative during my time in the upcoming panel, but I think for now what I will do is pass it over to Dr. Diana Singh, who will be moderating the current session and introducing each of the panelists. So thank you very much, Diana.
Good morning, everyone. Welcome to the first session of the day, our faculty panel discussion. My name is Diana Singh. I'm part of the ARMS team in the Faculty of Social Sciences here at McMaster and a postdoctoral fellow in the Department of Sociology. I'm going to be serving as the panel moderator for this morning's session. We are excited to host the following panel discussion, which highlights key research members from McMaster University who take a social science approach to understanding the prevalence, definitions, and solutions to mental health problems today. Each will outline their current research while underscoring the limitations of current mental health research in the social sciences. Before I introduce you to the panel, though, I just want to remind everyone, please keep your microphones muted during the panel. And all questions should be directed towards me, and you can do that using the chat function on the left side of the Gather Town screen. Okay, so let's meet our panel. Our first panelist will be Matt Savelli, who is an assistant teaching professor and undergraduate chair of the Department of Health, Aging, and Society. Matt's teaching and research interests cut across disciplines to examine how beliefs about mental health and illness evolve. His work explores how broader social ideas and ideologies shape medical practice and people's everyday experience of mental health. We will then hear from Kathy Georgiades, who is an associate professor in psychiatry and behavioral neurosciences and an associate member of clinical epidemiology and biostatistics, and holds the David R. Offord Chair in Child Studies. Her research program seeks to quantify and reduce inequities in mental health and academic achievement among vulnerable populations, particularly immigrant and refugee children and adolescents. Dr. Georgiades has published in top-tier social science and psychiatric journals, bridging that disciplinary divide. Next, we will hear from Isabella Granick, who recently joined McMaster University as an industry professor. We are enthusiastic to have her here. She comes to us as professor and chair of the Developmental Psychopathologydepartment at Radboud University, Netherlands, and director of the Gamesfor Emotional and Mental Health GEMH lab. Her research focuses on the positive effects of playing video games, including the cognitive, emotional, and social benefits. By integrating clinical and developmental research with interactive media design, she is creating a suite of evidence-based games that are also commercially viable and can be widely disseminated to slash the prevalence of rates of anxiety, depression, and bullying in youth. And last but not least, the panel discussion will then conclude with some remarks from Marissa Young. So I'd like to begin the panel and invite Dr. Savelli to present.
Wonderful. My microphone is working, everything is good. Thank you for that confirmation. Hello, good morning, everyone. Very excited to take part in the ARMS Symposium today, and more broadly excited to be involved with ARMS activities. So thank you both Marissa and Diana for putting everything together. I have a highly visual presentation today. So I'm going to try to share my screen, and let's just see if that will work. All right, can someone tell me, can you see this screen? I can't see you any longer, so if someone could just unmute for a second and tell me if you're able to see this. Please.
Yes, we can see your screen.
Wonderful, thank you. So I'm working on a number of projects right now. The one I want to discuss today is about the advertising of psychoactive substances. So we have called this, we being both myself and Erica Dick, who is a historian of psychiatry based at the University of Saskatchewan. We call the project Psychoactivity for Sale. And we're really interested in exploring how this concept of psychoactivity has ingrained itself into our everyday lives. So in a really general sense, psychoactivity is, it's really about the ways in which we can use substances, or a psychoactive substance, maybe this is the easiest way to define it as. A psychoactive substance is one that impacts a person's mood, thoughts, energy, behavior, and overall feeling. So this ranges from, the everyday substances like coffee and tobacco, alcohol that all of us consume on a somewhat regular basis, to, of course, also psychiatric prescription drugs. In this case, I've thrown up pictures of Valium and Ritalin, as well as what are often called illegal narcotics. But for the purpose of this project, we're focusing only on those that are legal. So the project kind of exists at the intersection of three broad strands of thought. So a lot of historians, including David Courtwright, whose book is up on the screen, have described the 20th century as a sort of a psychoactive revolution. Of course, humans have always used psychoactive substances, and we have historical records around our caffeine, our alcohol use, going back thousands of years. But in the 20th century, something really changed. And Courtwright argues that during this time, in part because of industrialization, in part because of changes to regulatory frameworks, in part because of broader sort of commercial expansion, people began to use psychoactive substances in a way that humanity has hitherto not really done. And we start to sort of integrate these things into our everyday life. The second strain of thought comes from people like Nicholas Rose and a number of sociologists who kind of draw on Foucauldian tradition to talk about the 20th century as a time during which people became actively aware of themselves as psychological beings. So Rose and others explore the way that the side disciplines, psychiatry, psychology, allied disciplines like psychoanalysis and social work, essentially through the discourse and narratives of those disciplines, we kind of begin to reimagine ourselves. We become aware of ourselves as beings with a psyche, and more importantly, as beings with a psyche or a psychology that has to be managed in some way. So Rose talks about just the ways in which we begin to sort of think about ourselves reflexively as possessing feelings, thoughts, moods, behaviors, and work towards, we begin to work towards managing those things, often through an intermediary, like a psychiatrist or psychologist, but more importantly, Rose argues, we actually kind of do this on our own, which is what I'll come back to a little bit later. And then the third strand of thought is really just related to the arrival of mass consumerism. So people like Victoria de Grazia, again, whose book is up on screen, have talked about how in the 20th century, consumer culture that we sort of associate with the post-World War II period, how that became globalized. And what our project does, Psychoactivity for Sale, it kind of brings these three strands together. The mass expansion of psychoactive substances, sort of the arrival of the psychological self, and the arrival of mass consumerism. So we're really interested in how global this story truly is. Is this something that would apply perhaps not equally, but to some extent in every corner of the world, or is this really a kind of a product of the global north? We're also interested in how different types of sociocultural conditions may have shaped the practice of what we would call psychoactive self-management. In other words, the ways in which people use substances to manage that daily psyche, to manage their daily feelings, thoughts, moods, and behaviors. So, I think on any given day, it's not hard to imagine someone, of course, having caffeine to wake up, perhaps some kind of psychiatric medication to moderate their feelings in some way, a drink, alcohol later to relax, or cannabis, a sleeping pill at night, and so on and so on and so on. So we're sort of interested in how different types of, for example, cultural conditions or ideological conditions may have shaped both messages around psychoactive self-management, but as well as the practice of it. And then finally, and most centrally, we're interested in the role of advertising in this process. So, for example, and this is an obvious one, our project actually spans the years 1886 to 2001. The reason for 1886 is that was when Coca-Cola, which most people would, I think, hold up as probably the sort of the psychoactive substance most widely consumed in the world. 1886 was the year that Coca-Cola hit the market. So if you look at this old advert for Coke, you see a number of references to things that relate to psychoactive self-management. Relieving fatigue, refreshing a person, something to take when you're weary or despondent, relieving exhaustion, etc. So what we've actually done is gathered about 6,500 ads for tobacco, alcohol, caffeine, and pharmaceutical products from newspapers, from medical journals, from popular magazines. We've gathered those from 5 principal case studies: Canada, Colombia, the ex-Yugoslavia, India, and West Africa, as well as we've sort of drawn on a number of other countries. Those are the ones highlighted in green, where we had a pretty large collection of about 5,000 pharmaceutical ads. So right now we're in phase 1 of the project. Obviously the pandemic has slowed things down. What you're seeing on the screen right now is a collection of our wonderful research assistants who are based across Canada. We've had to build a really, really, really large team, in part because of the linguistic challenges of such a project. So I think as of now, we've had about 20 different people working on the project, but we think it will get up to closer to 30 by the time we're done. Because although Erica and I can cover many of the languages involved, we cannot possibly cover all of them. So phase 1 has really been about collecting these ads, and we're building a really large database. Eventually, the goal is that this will be publicly accessible, where we've cataloged each one of these ads, and we're trying to make this searchable at the moment. Beyond that, of course, we're coding and looking for themes. We're on the cusp of doing that right now. It's early days, so I can't say too much about it, but we're just about done building the database itself. And then in phase 2, fingers crossed, we want to visit the corporate archives of some of the major players in this world of psychoactivity. So companies like Nestle or various pharmaceutical companies, large tobacco companies, and so on. I'm not naive enough to think that we'll get a ton of access to those archives, but luckily the University of California at San Francisco hosts the Industry Document Archives, which is sort of a massive collection of internal documents from the world of tobacco, pharma, and food, most of which those documents have become public as a result of court cases. So we're going to sort of use those documents to back up, support, or challenge what emerges out of the coding. Because, of course, a lot of the documents you'd find would include things like advertising plans, focus groups that they ran to try to work out which ads worked best, and so on. And what we're really hoping to do is explore the way that this practice of psychoactive self-management became a part of everyday life. So our hope is that in in going through these ads and then going through these corporate archives, we're going to be able to shed new light on, the kind of pre-existing debates around things like the globalizing of consumerism, drug regulation, mental health, and the role of the side disciplines in the 20th century. Beyond that, and if this sounds like a shirk proposal, it's because I pulled some of these bullet points from the shirk proposal. We want to, of course, train students in new research methods, such as semiotic analysis, qualitative content analysis, and so on. But also to make sure that this archive is available to students to conduct their own independent research projects. And then finally, because advertising is a highly visual medium, we are hoping that we're going to be able to reach out to the public beyond the normal sort of academic venues. That's it. I am done.
Thank you so much, Dr. Savelli. I will now ask Dr. Georgiades to share her screen and present.
Diana, are we good? Can you see my slides?
Yes, I can. Yep.
Okay, so I'll just start. There we are. Okay, thank you all, and thank you so much for this opportunity. It's really exciting to be here and to share some of the work that our lab is doing, or our research team is doing. We refer to ourselves as Advancing Youth Mental Health, and we really are an interdisciplinary team at the Offord Center for Child Studies at McMaster, really trying to improve child and youth mental health and to increase access to effective mental health care for all. Was that for me, Diane? No. Okay. Okay, thank you. So I'll just go on to my next slide. What my plan for
it sounds like we might be having a little bit of technical
provide you with an overview of a number of studies that we've conducted or are conducting, to give you a general sense of what we're doing, and also to really emphasize the availability of this data for training purposes, for research purposes, for policy and practice. And so it's really presenting perhaps a repository of research studies that I absolutely would welcome opportunities for collaboration. So really we're trying to establish a platform for child and youth mental health science, policy and practice, with the foundation being having trainees involved throughout the entire process. And we're really trying to integrate and harmonize data from population-based studies and also child and youth mental health services data. Really trying to measure and monitor child and youth mental health at the population level and access to care, but in particular across population subgroups that might be at elevated risk for either poor mental health or barriers to accessing mental health care. We're also very interested in detecting and forecasting changes in child and youth mental health and their social determinants, really trying to understand risk and protective factors that have some type of etiological significance for child and youth mental health so we can inform preventative and intervention efforts. And we've become increasingly interested also in measuring and monitoring outcomes among children and youth receiving mental health services.
Hi, I'm so sorry, Kathy. I don't mean to interrupt you, but I just realized that I don't think everyone can hear you in the room.
Oh, okay. Do you know what I need to do?
I can hear you.
I can hear you.
Marissa, are you able to hear Kathy?
No, for some reason I'm not able to hear her, but that's okay. Kathy, please continue your presentation, and Diana, just thank you for for being able to coordinate that.
Should I just wait?
No, please continue. I'm sorry.
Okay. So our methods are primarily observational research studies in the general population. We also use sort of clustered or stratified sampling approaches to really understand the social context in which children and families live and grow. So we're really interested in school effects and neighborhood effects. And we do use a mix of cross-sectional and longitudinal study designs. As Diana mentioned, we do have a special interest in immigrant and refugee children and their families and populations exposed to social adversity, with the aims of trying to identify modifiable factors for these families that might mute or offset some of the risks associated with adversity. And that's why we're really interested in schools as a setting that can potentially reduce inequalities and increase access to care. More recently, like so many, we have started studies on COVID-19 and the secondary impacts on child and youth mental health as well. And so now I'll just go through a series of studies that, as I said, that we're doing or that we've done. I really welcome the opportunity for collaboration and dialogue in any one of these. So our COVID-19 and child and youth mental health studies, we have a provincial study that began in January, and it's really designed to understand sort of over time how child and youth mental health, both mental ill health, but also positive mental health or well-being, changes or fluctuates throughout the course of the pandemic. So it's a longitudinal study of 1,200 parents with children between the ages of 4 and 17. And we're really trying to track change over time with a particular interest in how disruptions in services, if those are mental health care services, educational services, or social services, might alter those trajectories over time. And of course, with an interest in vulnerable populations or subgroups, if you will, so families who were exposed to poverty prior to the pandemic, are we seeing differential trajectories compared to those that weren't? And this study is funded by the Ontario Ministry of Health. We're also doing a national study that just received funding from CIHR to follow up a nationally representative sample of children who were 1 to 17 in 2019 and participated in a Statistics Canada survey called the Canadian Health Survey on Children and Youth. And the data was collected right before the pandemic, so from February to August of 2019. And we finally secured funding to follow up this cohort in collaboration with Statistics Canada and the Public Health Agency of Canada, many academic colleagues, and also many child health and advocacy organizations like UNICEF Canada, Children's Healthcare Canada, the Canadian Pediatric Society, and so on. And so it's a true partnership in trying to track, I hope it will be the longer term impacts of the pandemic, that the pandemic will be behind us by then, and the differential impacts across population subgroups again. This has been a long-standing sort of interest of ours ever since the pandemic hit, in really trying to advocate for the need to follow on a national scale a cohort of children to really be able to inform policy and practice at a population level. We also conduct epidemiological surveys of child and youth mental health in the general population. Our most recent was the Ontario Child Health. The Ontario Child Health Study and our school mental health surveys. These are population-based studies in Ontario. The Ontario Child Health Study was really designed to determine the prevalence, distribution, and correlates of child and youth mental health and access to care. It's a large population sample of 10,500 children between the ages of 4 and 17. And in conjunction, we've conducted our school mental health surveys, where we've sampled schools within the same communities as the families participating in the Ontario Child Health Study, really trying to understand practices, processes, resources within our schools that could support student well-being, offset or mute social inequalities in children's outcomes. And so we've taken a multi-informant perspective. We've got students, teachers, principals participating in that survey. I just wanted to highlight that many of our studies are really interested in income inequality. And so for the Ontario Child Health Study, I think an innovative feature was that we selected communities across the province. They're called primary sampling units, 180 of them. And those communities, if you will, were grouped into sort of low income, middle income, and high income. And then within each of those communities, we sampled households, low, middle, and high income households. So this type of study design, for those of you interested in socioeconomic inequalities, it serves at least two objectives. One is that it ensures we have adequate representation of low-income families, but also high-income families, because we specifically sampled across those strata. But it also helps us understand the dynamics or the social processes that unfold when a household income is incongruent with the community income. So if you're a low-income household living in a high-income neighborhood, or vice versa, do certain social processes unfold that either serve to protect children and families or potentially increase risk? So the income piece was a real important feature of the Ontario Child Health Study, as I mentioned, for those of you interested in income inequality and its relationship to health outcomes. Some of the unique features, we had those clustered sampling approaches, so we can study neighborhood effects, school effects, family effects, because we've sampled multiple children in a household. The income inequality piece, the multi-informant piece, so parents, like the primary caregiver, the spouse, the youth, the teacher. We've tried to collect information from a number of individuals in a child's life, and that cuts across different contexts in which children live and grow. We also link to administrative data. So for those of you interested in educational outcomes, we've linked to Ministry of Education data and health data. So you can see how many times a child's gone to the emergency room or a family physician visit. So there's lots of linked data available. Our school climate data. And we really take an ecological approach to understanding child health and well-being, really trying to measure components of a child's neighborhood, their family, their school, and their own individual experiences. We also are very interested in immigrant refugee children, so I'll just touch upon two programs of work that we've been engaged in locally for this work, which is it's so great to be able to work in Hamilton and work with community partners. Our Hamilton Youth Study was a partnership with the Hamilton District School Boards and settlement agencies. Started many years ago, where we engaged in the school boards with a strong interest in understanding what many people refer to as the immigrant paradox. And what that describes is a body of evidence that suggests that immigrant families, children, adults tend to have better health outcomes than you would anticipate given their social economic circumstances. So many studies that do comparative analysis of immigrant, non-immigrant populations find that immigrants tend to do better, if you will, better in terms of mental health, better in terms of health. And the educators we were speaking to, administrators at schools, were saying, what on earth are you, on the ground we're seeing a very different profile of outcomes, and they really highlighted two population subgroups within this broad categorization that we often refer to as immigrants that they had particular concerns about in terms of supporting them. And that was English language learners and refugees. And so through this dialogue and collaboration, we developed the Hamilton Youth Study. This is a study across 36 schools in Hamilton. Schools are grouped into schools with low concentration of immigrant students, moderate and high, because we're interested in how the composition of schools might influence student outcomes. And then within each of those schools, we've selected different groups of children, first-generation immigrant children, second-generation, and non-immigrant. So it includes about 1,500 students in grades 4 to 8. We've collected information from them, their parents, their teachers, again, linked to school record data. And really it's trying to understand patterns across immigrant and non-immigrant student populations, but also within the immigrant population. How can we differentiate those that are doing well, because there's definitely lots of evidence of resilience in this population, and what are the outcomes in which they might be struggling and may warrant additional support within our schools and within our communities. So this study is complete with data available, again, for those of you interested. It's unique in a number of ways. We had a team of 20 interviewers speaking many, many different languages, so we can enlist non-English speaking populations. something that many of our epidemiological studies don't do, and lots of really rich information around mental health in this population. And now we're engaging in some new and exciting work led by a postdoctoral fellow of mine, Amanda Sim, where we're trying to really understand the mental health needs of newcomer children and families, with particular focus on Syrian refugees that have recently resettled in Hamilton. Lots of partnerships, again, within the community, the YMCA, Wesley Refuge, our school boards, the city of Hamilton, and really starting again from collaborative dialogues across different stakeholder groups to design our studies and develop ways of sharing the evidence and ensuring uptake of the evidence. We're really trying to establish methods for collecting mental health data in this population and understanding their needs, and then really with an emphasis on developing and evaluating preventative interventions for this population. And this work is really just beginning. So for those of you interested in engaging in this type of work, I'd really encourage you to reach out to myself or Amanda to learn more about it. But it's quite exciting, and the partnerships within our community have been fantastic. In terms of challenges, I'll end with this. Sustained funding for our program of work is always a challenge. You often get funding from an agency, and when that's done, it's really hard to maintain the work that you're doing until you're able to get funding again. So we have a lot of, they're not disparate projects, but ideally if we had, one or two that we could follow over time using longitudinal methods, it might alleviate the need for, constantly applying for funding to build a new project. And the cost of doing this type of research is quite high, unfortunately. Another concern is access to comprehensive sampling frames. For those of us interested in general population surveys where we can generalize back to a population of children to inform policy and practice at a population level, it's really, really hard to access these sampling frames to feel confident that you can generalize to the population of children. Like many of you, data access is often a challenge, linkages and harmonization and integration. If we could leverage all the projects that we have and identify ways of linking them and harmonizing our measurement and methods, we would have it would just help, exponentiate the evidence that we can bring to the table when we're trying to inform policy and practice. And one of the challenges in doing this work we're noticing, and Stats Canada talks about this too, is just decreasing response rates over time and respondent burden. How can we make our work more engaging for participants to participate in? And what can we give back to them instead of just collecting information? How do we share it back in a way that's meaningful for the people that are giving so much of their time? So I'll stop there and I'll say thank you. And I'll stop sharing my screen.
Great. Thank you so much, Dr. Georgiades, for sharing your research with us and those insights. I'm going to invite Dr. Granick to now share her screen and presentation. Thank you.
So my name is Isabella Granick, and I have just moved, well, not just moved, and a year ago I moved from the Netherlands back to Toronto. I'm native Toronto, and I was there for a decade as a professor looking at the effects of media in young people's lives, in particular their mental health and well-being. And I quickly went from worrying a lot about the kinds of interactive media that they were using to actually being incredibly impressed, optimistic, and fascinated by what young people are able to take from their interactive media experiences and work with for their own mental health and well-being. But that was a bit of a trajectory, so I'll just let you know a little bit about that trajectory first, and then move to some of the future work we're going to do. So right now, my most important goal is to figure out how to support, empower, and then amplify young people's abilities, their own abilities, to interact online in a digital context and also offline, online, that hybrid space, in a way that is is most elevating in terms of their mental health and well-being. And I have a very strong sense that a lot of what the new innovations that are going to be coming in these digital contexts are going to be coming from young people themselves. So part of what we do is I want to empower parents, clinicians, and teachers to talk with young people about their preferences and their activities in these digital contexts, because we can learn an enormous amount from them. And then, of course, try to guide them in terms of them being basically the next future architects of our design, our digital context. So first, I just need to acknowledge that we've gotten amazing funding from the ERC in Europe and the Dutch Science Foundation. This is my amazing lab. All of these people have done all of the work. I just talk about it. So what we have become increasingly interested in is thinking about identity and narrative identity in particular, how young people, and actually all people, make sense of their world around them by telling stories about who they are and sharing those stories and getting feedback in social context and cultural context around the story of who they are. The most important thing really is that you guys need to know who, this is the great lab. They're my helpers. So really they're the most important that everybody should see. The other pretty pictures are fine, but it's really important to know that I have an amazing team that works with me, and they're very much a multi and transdisciplinary team at this point, where we have artists, designers, psych science, graduate students, programmers, engineers, and so on. It's just a fabulous group to work with, and we continue to sort of push those boundaries of disciplines. So what I was saying is that we're really interested in this narrative identity framework and understanding adolescent and young adults' developmental needs, and how we can help grow a new generation of internet architecture that might better foster their developmental needs with and for these young people themselves. We have been interested, we started being most interested in trying to address the most prevalent mental health issues, including anxiety and depression. You all probably know that anxiety is the number one mental health concern being diagnosed right now. 1 in 4 young people will be diagnosed by the time they reach 18. Those numbers are only growing after or during the pandemic. So what we've done, our approach, is to go into the digital contexts that are most relevant for young people, and that is games and social media. And we started with games, and our approach is to take the scientific principles and practices that we know work, things like exposure therapy, attention bias modification, behavioral activation, and so on, or neurofeedback in the case of Mindlight. And then we integrate this into games that are beautiful. We work with artists and designers from the start, so we don't start, only in our own sort of science world, where oftentimes the kind of applied or serious games that come out of that context are not engaging young people the way that we want to, and we know that retention is terrible in those kinds of most games that we've designed for young people's mental health. So we have several games. The first is Mindlight. Another one is Deep, which is a VR mental health game where you're underwater in a scuba diving thing, and it's reading your breath, and the way that you move around in this context is with your breath. And then we've also partnered up with Bree Code, looking at her self-care. And although I would love to go into each one of these games, to do that would take an hour. So what I want to just give you an idea is just that there's a variety of types of games. The last one's mobile, the second one is VR, the first one is just on a desktop, that can be designed in order to both engage and delight young people while they're also actively working on skills that help them, that help prevent anxiety and depression, and also empower them in terms of emotional resilience. And we have done a series of RCTs with all of these games, and just the quick and dirty summary. This is one example of one large randomized controlled trial where we registered a non-inferiority study, which meant that we were hypothesizing that our game Mindlight would be as equally effective as cognitive behavioral therapy. As most of you know, CBT is the number one evidence-based practice for children with anxiety. And so we wanted to test our game across the gold standard or against the gold standard out there. And what you see here is pre-test is before they started playing the game or going into cognitive behavioral therapy. Post-test is 3 months later. 8 sessions later, and then 3 month and 6 month follow-up is exactly what it sounds like after they've stopped playing the game or not gone to therapy. And so what you'll see is our results are, as hypothesized, incredibly optimistic. So Mind Like the Game, a video game, which they played 8 times, was as effective as cognitive behavioral therapy to decrease anxiety in kids who were selected for being high in anxiety already. And these results ended up staying strong all the way out to 6 month follow-up, which is really, really, for us, a kind of not only optimistic outcome, but just seems like an untapped area that we can really use in all sorts of follow-up studies in terms of both designing new games that share similar kinds of principles and mechanics, but also we're very interested in moving out what we've done into not only the world of everyday families where they can use these games, but also to help industry and other academic contexts learn how to design these games with an equal attention to the art and design as well as the scientific principles. So just one more word about that. The reason why I have left full-time academia and am very, very privileged to be an industry professor right now at Mac, is to try to bridge this immense gap between industry and how fast they're going and how responsive they are to market needs or perceived market needs, and the science that is out there. Slow, laborious, but incredibly important to do, of course. And somehow these two things have to come much closer together. Otherwise, the games and apps that we develop in a scientific context, testing them oftentimes in scientific context, will never get out to the people who we're trying to actually have an impact on. And so, for example, Mindlight has been out for 7 years, or it's been done for 7 years. We've had evidence for the last 3 years that it's as good, if not better in some contexts, than CBT, but we can't get it into the hands of any young people because we don't have distribution, we don't have marketing, I'm so sorry, and we don't have a means by which we can keep supporting the technology by updating it all and so on. That all takes money and support and so on, and it's just a different kind of infrastructure. So part of what I'm very interested in going forward is to try to figure out models where academia and scientific research can much more smoothly integrate with industry, especially industry and companies that are deeply interested in mental health or well-being outcomes. And we know from the app stores and so on that there are plenty that are interested. They just don't have the science and the resources and knowledge to get that out to people. Okay. There's another big problem when we try to design games or apps or digital context more broadly for young people. And that is an incredible negative bias towards these contexts in the media, and therefore parents, clinicians, teachers, adults who really care about these young people are deeply concerned, I'd say for good reason, especially from the media hype, about the impact of these digital contexts. And so we get lots of these kinds of headlines about our smartphones are destroying a generation and video games will be the death knell and so on. This one was quite funny. During COVID, you had the WHO saying that video game addiction is officially considered a mental health disorder. Many of us wrote to the WHO pleading to think about the evidence or lack thereof, about thinking about gaming disorder as a disorder at all. And meanwhile, the pandemic starts and the WHO says playing video games is healthy social pastime during the pandemic. So adults who care about kids and how they're developing in their digital context are confused for very good reason. There's lots of science that I won't get into suggesting that either there are no negative impacts of social media on mental health outcomes, or they're very, very small, and they're particularly located in populations that are more vulnerable from other contexts, and we all know those contexts. So it's really important to know that the evidence right now is showing very little harmful effects of these digital, either social media or games. So what we're doing is trying to now partner up with adolescents themselves and think about media as we can't think anymore about media the way that we did in research before, where it was this thing outside as leisure, and we study the impact of it 1 or 2 hours a day. As we all know, not just for kids, we live in this hybrid reality right now, that kids are going back and forth from their digital to their offline worlds in ways that are not at all clear what the boundary is. And for them, for sure, they don't perceive that boundary in any simplistic way. So we need a developmental lens to understand what's good and bad in these contexts. And we have a century of research and theory around developmental science to know what those might be. And theory here will help us guide new empirical studies, new apps and games that we can design with artists and designers, and also have an impact on AI, which I think is another talk, but a really important one, because we could take the power, just like we could take the power of games, we could take the power of AI and use it in such incredibly creative and important ways, transparent ways, to empower young people to use AI in ways that are much more collaborative and empowering in different sorts. So I will have to, unfortunately, I don't know how much time I have, because now I'm kind of, sorry, can somebody tell me how much time?
You still have some time left, absolutely, Isabella. I'm going to cut mine a little bit short because of our technological difficulties, so please go ahead for another 5 minutes if you'd like.
Okay, 5 minutes, all right. So the framework we're taking is a narrative identity framework. And that is, we start in this center middle, and we know that young people require agency and a sense of communion or belongingness, okay? They themselves need those developmental needs to be met so that they can develop a coherent narrative about who they are, who they want to be, linking those to values and aspirations. And this is so very, very important. And of course, these individual narrative identities are always constituted within a social context. And so the storytelling interpersonal context is really important for us to think about when we think about new digital places and platforms that we want young people to design themselves and also actively participate. Because it's in those social contexts that all the elaboration happens, where you get listeners helping you think about your narrative identity and how grappling with contradictions and how you can reify or change that narrative for your own mental health and well-being. Then finally, we know that these storytelling interpersonal processes are very much culturally constrained. So we have these master and alternative narratives that we want to keep in mind because, for example, right now, we don't know what the impact of, we know that social media is generally not a negative impact on young people. And there's lots of science right now in the last 5 years that have done, longitudinal science, that have absolutely nailed this down. It doesn't matter, though, because the societal context and the media context continues this narrative about how harmful these digital interactions are for young people. The problem there is that these young people themselves are self-stigmatizing. And so these cultural stories that are being propagated somewhat by adults, but also then by young people themselves who internalize them, it's a important question to ask whether those internalized negative, stigmatized digital stories are going to have a bigger negative impact on them than their actual activity on their devices. So what we're interested in right now is how to build media with and for young people that will help them reflect about these processes across these scales. And so we have some new funding from the Templeton Foundation that we're very grateful for, and we're going to start at MAC now with this funding to design a platform and an app that first and foremost has a goal of simply reflecting to young people what they're doing across their digital context. So we're not designing a new digital social media or whatever it is. We're taking everything that they're doing in there and with their consent, very transparent consent, scraping all that data and showing them in a really playful way what they're doing and helping them access their values and their aspirations and linking those values and aspirations to their digital activity, both online but also offline as well. And so we've been funded to do that because I think everyone can kind of see that there's an important element where we want young people to, the thing we don't want them to do is to stop reflecting about what they're doing, is to do things robotically and so on. We want them to think about what they want in their content and then ask for that from their digital products. And then eventually my hope is to also for them to be building and designing them themselves. So this is really the effective optimism kind of outlook that we're launching with the Templeton Foundation grant. And it's the idea that we can be very optimistic about young people's ideas about what they want to do with Web 3.0 and the kinds of micro communities that they themselves have started building that seem just incredible in terms of their potential for building belongingness, sharing aspirations and values, and finding your people across the world, but in these micro-solidarity kinds of communities. So we're very optimistic about that, but of course we want to also make sure to study and evaluate these outcomes as they unfold. And so we have young people on our board always. We have youth advisors from the start of every project that we've done, and the Templeton one, we also have them on board, and they will be telling us what they care about and what they don't care about in their digital communities. We are very serious about providing them agency and then giving them a community to share that agency with us if they want. I will skip over all of this, I'm sorry. And just to say that young people themselves are socially engaged in all the games they're doing. 85% of the games that kids are playing are in a social context. It's not alone. And so we think there's some incredible potential for them to tell us what works and what doesn't for them. And I probably am out of time, so let's just end there. I'll just end with three principles. We really care about doing no harm, so stopping the stigma and asking them what does and doesn't work for them. Getting out of their way, they can be designers and give us amazing feedback as we're designing technology for them. They have amazing insights that we learn from them all the time. And then finally, we want to just listen, empower, and then follow them. And it's really important that we take these developmental principles and give young people the emotional context to feel supported and safe, but also give them the freedom to start designing on their own and to feel like they can build their own digital future and the digital future for their own generation. I think this is really important. I'll just end there. Thank you.
Great. Thank you so much, Dr. Granick, for sharing your research. We are conscious of time, so I think that we are going to move into the Q&A period now, and then I will hand it to Dr. Young to make some concluding remarks. So if there are any questions, I will ask all of the attendees to message me in the chat, and I will pose the questions to the panelists. Okay, I have a question for Dr. Georgiades from Matthew Mello. Hi, Dr. Georgiades, great presentation. You mentioned that you were doing a study on income inequality and health and how children of different income levels are affected by income inequality. I wanted to ask, how do you think this influences a child's mental health? I know that some government housing is placed in higher income neighborhoods. For a child living in government housing, could this maybe have a protective effect since high income neighborhoods typically have more access to resources and are safer? Or could this potentially hurt a child's mental health due to potential social exclusion and a lack of feeling welcomed in such a neighborhood?
Yeah, that's as they say, the $1 million question. Yeah, it's such an important question. And I I welcome others' thoughts on it. We did look at it to some extent in the Ontario Child Health Study, and that's really just one piece of evidence. But I think it could go both ways, Matthew. It's a really good question. In the data that we had in the Ontario Child Health Study, to our surprise, if you will, we found that low-income families living in high-income neighborhoods did poorer. Because our hypothesis was exactly what you had articulated: greater resources, more support in the neighborhood in terms of childcare and access to other types of social services. But that wasn't the case, in that we think some of those community processes around collective efficacy, social cohesion, might not be unfolding in the way we would like as we try to sort of integrate sort of lower income populations within these communities. And so one might argue that we should invest in those low income communities and ensure they have the resources they need. So we found that sort of somewhat, if you will, these differential social processes along SES lines serving to be associated with poor mental health outcomes in children. Now, this is all cross-sectional data. It's not like a trial of any sort. It's all observational. But in this one Ontario Child Health Study paper that we have that has been published, those were the results we found. But I think there's evidence going both ways. So thank you for that question.
Great, thank you. Are there any other questions? I am looking in the chat. I don't see. Okay, so I have a question for Dr. Granick from Dr. Young. Given the importance of the digital community in your research, what are your views on the role of physical community for adolescents' well-being?
Yeah, what a great question. And of course, right now, what a great question. Having been with my two 15-year-olds at school in Toronto, and the most of that being virtually, and seeing the real difficulties that ended up engendering. So I think one of the interesting things about this last year for those of us who were struggling, or those kids who were struggling to not be able to go to school, is how much they realize they do want that physical contact. And I think young people have known this all the time. I just think it's a really interesting mindset click right now where they talk about it much more. I don't have data on this, of course. I have my children and the 20 others that come into the house. And I think what's interesting all along that we've had is that even when we were designing games, we moved very quickly from the desktop games to mobile, because the mobile games are there in their pockets wherever they are, and those wherever they are contexts are very much in physical contexts. And it's fascinating, we have loads of studies observational studies looking at the extent to which kids are in a physical space together, mushed together on the same couch, meanwhile on their phones, also interacting and so on. So I think that that physical community is really, really important, but not necessarily to the obfuscation or the deletion of the digital communities.
Great, thank you so much. So I just want to note that Dr. Savelli had to teach a class, so he has stepped away from the panel. If there are any other questions, please feel free to put them in the chat. I will monitor this. Oh, we have a question from Allison. We've been working with a serious game for young adults with disabilities interested in taking the bus. It's a good game in terms of learning, but not very engaging. Are there insights from the paid gaming community that we need to start applying to serious games? I imagine this question is directed towards Dr. Granick.
Yes, and so one of the really exciting things that around the Templeton grant that we just got is that half of the funding goes towards designing a prettier version of our toolkit. So for the last 10 years, we've been we have a framework that we've developed largely from terrible mistakes that we made in the first couple of years, working with designers and artists who we were not speaking the same language for a long time. And so this toolkit is meant to be a eventually free resource where both academics and industry can think about how to work with the other in effective ways, and how to fundraise from that for those purposes, who to get onto your board immediately, like the young people themselves who would be going onto the bus and have these challenges. I mean, we all know in psychology research that participatory sort of research is important and interesting to get qualitative insights, but when it comes to designing something and a product, it absolutely, you can't do it otherwise, because the hysterical mistakes you make from the first day without talking to young people themselves and how they would use it. So it doesn't even have to be about money around really pretty graphics. It's not about graphics. That's another thing we've learned. It's absolutely not about graphics. But the fun mechanic aspect has to be prototyped in really specific ways, and user research around prototyping that designers have been taught to do in their design schools for the last couple of decades are super important and really easily folded into our scientific practices. So the short answer is we're going to have a toolkit that we can share with you. The shorter answers you can ask me, and I'm happy to talk with you about maybe what next stages could be for you.
Great, thank you, Dr. Granick. So I am conscious of time, and I am going to now conclude with the Q&A period and pass it back to Dr. Young for concluding remarks.
Thank you so much, Dr. Singh, and thank you to all of our panelists and all attendees for your patience with this new platform as well. All three of those presentations were fantastic and a great way, I think, to kick off the ARMS Symposium. I believe you're sort of like the frontiers in trying out this new technology. And so again, I appreciate your patience. We are now going to take about a 10-minute break and all gather then in the working group room to then have an exciting discussion with the co-editors of a top ASA journal, or the American Sociological Association journal, Society and Mental Health. And so I'll introduce our co-editors at that time. The working group room, if you exit the panel discussion room here and head up, or I guess we'll say north, and then you'll find the entrance to it on your left-hand side. Thank you again so very much to all of our presenters. Diana, thank you for moderating the session. I look forward to seeing you all throughout the day.